welcome to HITea with Grace, where we spill the tea on HIT. I'm here at the Health Conference speaking to the industry's greatest leaders in health information technology. So tell me, who are you and what do you do?
Well, my name is Feyi Ayodele. I am the CEO and co-founder of a company called CancerIQ. We are on a mission to end cancer as we know it through early detection, prevention, and personalized treatment.
So critical in this day and age. So what is the most underrated challenge or problem in the industry right now that people aren't really giving much attention to?
I think there's so much that's happened in the science and the ivory towers of academia. People forget that these need to get to actual real patients. And 85% of patients are seen and treated in non-academic community-based settings. Well, you really need to think about two things. One, how are you actually going to do this without the same kind of operating environment and level of staffing as the academic centers? Academic centers, you might have a fellow, a resident, a data manager, a precision medicine navigator. And in communities, you might just have a doctor in their MA. So as we've been innovating at CancerIQ, we've thought about everything, including overcoming some of those operational barriers with technology.
Yeah, and what trends are you hearing in the health hallways that really impact the work that you're doing?
Well, I think some of the trends we're hearing about is you got to try to figure out the money and the mission, right? Especially in cancer nowadays. There have been incredible, budget cuts, unfortunately, for research, and even our health systems are feeling a little bit of the pinch. So what I hear in hospitals right now is a lot of these innovations that are going to be prioritized are ones that have a tangible return on investment and a tangible return on investment that can happen in as short as period as possible. So we're fortunate at CancerIQ that we're doing well and doing right things for patients. We're able to quantify just how many incremental procedures or preventive oncology services are happening because patients have been identified through CancerIQ, and that's keeping healthcare interests and our growth pretty high.
So inspiring. Now, my listeners love to learn about trends in the space, like what you're doing, but they also love to learn about leaders and what's on their mind and what drives them. So tell me, if you could give your younger self a piece of advice, what would you tell her?
I guess, a younger version of myself, I would say, guess what happens when you actually prove that you can do what you say you do? Being an innovator in healthcare IT takes a really long time. And for, I'd say, the first third of our company's life cycle, we're just trying to get to product market fit. Then we started producing evidence on what CancerIQ can actually do. We can actually reduce the number of late stage cancers by 42%.
Wow.
We can generate up to $180 to $200 for every single patient who goes through our platform. We can stage shift, we can increase patient uptake, we can help with patient activation. And once we had all of these numbers in our portfolio and could prove them to health systems, that's when things really took off for us. So being able to make it through those first two phases, I'd say to my younger self, be patient, Faye. It will happen.
Love it. Thanks for joining me today.